Hello, I welcome you all to this series where we talk about matters concerning health. Today we are going to discuss a question that someone asked me. What causes low manpower? Well, manpower can be defined in different ways. In the world of business, it is defined as labor or workforce. The word manpower is also used in an informal manner among different folks to mean sexual function. And I believe the person that asked this question was actually referring to male sexual dysfunction. Male sexual dysfunction among males is quite a common problem. It affects over 30% of young males and over 50% of older males, that is from the age of 50 and above. It comes in different forms. It can come in the form of a low libido, which means someone has a low sexual drive or a reduced desire to have sex. It can also come in the form of erectile dysfunction, which can be a complete failure of a male to erect or an inability to sustain an erection for a considerable amount of time. It can also come in the form of orgasm disorders, for example, premature ejaculation or a failure to ejaculate. So all of this can come due to various causes. I think let's begin by discussing low libido into greater detail. So a low libido, like I said before, is a reduced sexual drive. In other words, it's a reduced desire to engage in sexual intercourse. Low libido can result from hormonal problems. Talking about the male, it can be due to a low level of testosterone. This can be corrected in the hospital by hormone replacement therapy. In other words, you can be given an artificial form of testosterone. The second hormone that is sometimes implied in low libido is prolactin. Prolactin, when it is in excessively high levels in your body, it tends to reduce your libido. Prolactin is the same hormone which is responsible for the production of milk. So usually someone who has a low libido due to a high level of prolactin is likely to be discharging a milk-like substance from their breast. The other possible cause of a low libido could be psychiatric disorders. There are a number of psychiatric disorders that are associated with a reduction in libido. The most popular one could be depression, major depressive disorder. So it's possible that if you have a low libido, you could actually be depressed. There are other disorders like anxiety disorders that can also reduce your libido. The other problem that could cause a low libido is, relationship problems. You could not be, in good terms with your spouse. You could be having insecurities. Perhaps you think your spouse is cheating on you, or perhaps you just made the wrong choice and picked someone who doesn't really appetize you that much. So this can also have a tendency of lowering your sexual drive. Erectile dysfunction, on the other hand, is either a complete failure to erect or an inability to sustain an erection for a considerable amount of time to allow successful copulation. Erectile dysfunction can be caused by diseases. For example, diseases of the blood vessels. A common one is atherosclerosis. It is the same disease that causes angina and other issues to do with the heart and blood vessels. It's the same disease that leads to high blood pressure. So this disease also affects the blood vessels of the penis and can make someone either unable to erect or unable to sustain an erection. Someone could also be having issues with the nervous system. So this can be a peripheral neuropathy where the nerves around your genitals are not functioning properly, or it could be a central neuropathy where nerves high up in your spinal cord or in the brain are not functioning so well, so they are unable to pick up these signals coming from your genital area. It can also result from other diseases of the brain, for example, a stroke and any other encephalopathy or condition of the brain. Erectile dysfunction can also be caused by some medications. A good example is drugs that are used for patients with high blood pressure. Remember, an erection is entirely dependent on a buildup of pressure in the penis. So these drugs sometimes make it difficult for that pressure build up. There are also other drugs of abuse that can cause erectile dysfunction, for example, alcohol. Even people who smoke cigarettes are likely to develop this problem, and people who use any other recreational drugs, for example, marijuana. Another possible form of male sexual dysfunction could be premature, which can also be due to a lot of causes. It's also related to drugs and drug abuse. It can also be related to, psychological and psychiatric disorders and things of the sort. So I hope you really benefited from this video. I hope you learned something new. In case you haven't yet subscribed to my channel, please tap on that circle that will appear on your screen bearing our logo or our profile. Just simply click on it and it will give you an option of subscribing on screen. Feel free to ask more questions concerning your health in the comment box below, or through my email or other platforms that I've shared in the description of this video. Also, feel free to give me feedback in form of comments. Thank you very much for sticking with me to the very end. I'm looking forward to seeing you in the next video.